group of eye hospitals, Indiranagar branch deserves a special mention because this is a refractive hub of the entire in order to cater to dry eye patients. On occasion of a birthday of a beloved chairman, Professor Dr.Agarwals, and our director, Professor Agarwal's birthdays in this month, we have an exclusive offer going for smile patients, and we have offer going for dry eye patients also. So I request all those who want to get rid of glasses, they can make use of this wonderful opportunity.
What Dr. Agarwal as a group is, we are a 65-year-old group, started our hospital 65 years old, and today we are already 113 hospitals strong, and we are growing. We are growing very quickly, and in 2 to 3 years we expect to be close to 200 hospitals. We also have started our vision centers, which is really an outreach to go to far and distant places where hospitals. We already started that journey, and very soon in 2 to 3 years we should be 500 vision centers as well. We call that our 2020 centers. So that which is the perfect vision is what we are achieving for, and hence we will be looking at 500 vision centers there as well. Coming specifically to Karnataka, 4 branches, 4 hospitals, 2 in Mysore, 1 in Hubli and 1 in Dharwad. We won't stop here. Our investments in Karnataka will continue. In fact, as we are speaking Karnataka, we have a lot of commitment into Karnataka. We are really thankful to the government, the way they have supported us in this journey, in this very, very long journey, in able to do better patient care, in able to get better technologies. Today is an example of the technology that we are bringing in. Of course, our esteemed doctors will talk about it, but that's our commitment to the state and to the city.
ಆಸ್ಪತ್ರೆ 10ಕ್ಕೂ ಹೆಚ್ಚು ಶಾಖೆಗಳನ್ನು ಹೊಂದಿದೆ. ಇಂದಿರಾನಗರ ಶಾಖೆಯ ವಿಶೇಷತೆ ಏನೆಂದರೆ ಇಲ್ಲಿ ಎಲ್ಲ ವಯಸ್ಸಿನ ರೋಗಿಗಳಿಗೂ ಕಣ್ಣಿನ ತೊಂದರೆಗೆ ಬೇಕಾದಂತಹ ಎಲ್ಲ ಆಧುನಿಕ ಉಪಕರಣಗಳು ಹಾಗೂ ಶಸ್ತ್ರಚಿಕಿತ್ಸೆಗೆ ಬೇಕಾದಂತಹ ಯಂತ್ರಗಳು ಇಲ್ಲಿ ಅವಲಭ್ಯವಿದೆ. ಮಕ್ಕಳಿಗೆ ಬೇಕಾದಂತಹ ಚಿಕಿತ್ಸೆ, ಮಧ್ಯವಯಸ್ಕರಿಗೆ ನಾರ್ಮಲಿ ಬೇಕಾಗಿರೋದು ಕನ್ನಡಕ ತೆಗಿಲಿಕ್ಕೆ ಇರುವಂತಹ ಶಸ್ತ್ರಚಿಕಿತ್ಸೆ, ಹಾಗೂ ವಯೋವೃದ್ಧರಿಗೆ ಸಾಮಾನ್ಯವಾಗಿ ನಾವು ಶಸ್ತ್ರಚಿಕಿತ್ಸೆ ಮಾಡುವುದು ಕಣ್ಣಿನ ಪೊರೆ ತೆಗೆದು ಲೆನ್ಸ್ ಹಾಕುವುದು. ಆ ಶಸ್ತ್ರಚಿಕಿತ್ಸೆಗೆ ಬೇಕಾದಂತಹ ಆಧುನಿಕ ಉಪಕರಣ ಸೌಲಭ್ಯ ಈ ಶಾಖೆಯಲ್ಲಿ ಅವಲಭ್ಯವಿದೆ. ಕಣ್ಣಿನ ಪೊರೆ ನಾವು ಸಾಮಾನ್ಯವಾಗಿ ಹಾಗೂ ಅತಿ ಹೆಚ್ಚು ಸಂಖ್ಯೆಯಲ್ಲಿ ನಡೆಸುವ ಶಸ್ತ್ರಚಿಕಿತ್ಸೆ. ಯಾವುದೇ ಚುಚ್ಚುಮದ್ದಿಲ್ಲದೆ, ಯಾವುದೇ ಬ್ಯಾಂಡೇಜ್ ಇಲ್ಲದೆ ಕೇವಲ 5 ರಿಂದ 10 ನಿಮಿಷಗಳಲ್ಲಿ ಶಸ್ತ್ರಚಿಕಿತ್ಸೆಯನ್ನು ಲೇಸರ್ ಉಪಯೋಗದಿಂದ ಮಾಡಿ ರೋಗಿಗಳು ಮನೆಗೆ ಹೋಗಬಹುದು.
Big day for us. We are launching the dry eye speciality clinic at Agarwals Eye Hospital in Indiranagar. Now, this is the first of its kind technology that we have in all the Agarwal branches. So, just to give a little introduction, we know that the most common symptom of the eyes we see is a dry eye, and every one of us would have experienced this at some point in our life. And especially with the recent times in the pandemic, we do have a lot of work from home opportunities for the IT professionals, and a lot of online classes and other online courses for people. So this has increased our use of gadgets, computers, mobile phones, TV, laptop, etc. And most commonly what we see is dry eye. So when we say dry eye, the first thing is it's not just the eyes are very dry all the time. It can be that amount of tears is what is produced in the eye are sufficient, but still the patient may experience dryness. So patients come to us saying there is irritation, burning sensation or redness, itching, etc. And on examination we see that their eyes are dry. So most commonly you all would have used some sort of eye drops where the eyes are kept moist, and for some time it is beneficial, but again you may come back with the symptoms saying that I have used enough number of times but still I don't feel much of a relief. So in such cases, not only eye drops, we also give tablets to improve the symptoms. But what if you are using the drops multiple times in a day and still you are not feeling comfortable? So in such cases, the new technology that we have at Dr. Agarwals which is called as the dry eye treatment, which is basically called intense pulse light therapy. And this seems to be extremely beneficial to our patients who are not just happy using eye drops multiple times a day. Now what it does is, it's a very simple technique where the patient walks in and walks out in just 10 minutes time, and we do give some light therapy around the eye, which will stimulate the glands to produce more tears and also improves the quality of tears. And the advantage of this is there are no extra side effects associated with it, and there are no extra care that the patient has to take after the procedure. He can walk in, walk out, just 5 minutes procedure, and he is absolutely fine by the end of the day, and the next day itself they feel very comfortable, and we see about 90% improvement in the symptoms by the next day itself. So this is an amazing technology that is available with us, and with the recent times,
1,20,000 ಆಗುತ್ತೆ. ಈ ತಿಂಗಳು ಮೇಡಮ್ ಹೇಳಿದಾಗೆ ಆಫರ್ ಇದೆ. ಇಟ್ಸ್ ಅರೌಂಡ್ 25% ಆಫರ್ ಇದೆ.
Now about 10% of the cases dry eyes mortality. Even because of pandemic and excess use of all these gadgets, it has almost gone up to 30%. And E number ashtikke stop agala. In the coming years, it will even increase up to 45% in the next 5 years is what is expected. Now about 10% of the cases dry eyes mortality. Even because of pandemic and excess use of all these gadgets, it has almost gone up to 30%. And E number ashtikke stop agala. In the coming years, it will even increase up to 45% in the next 5 years is what is expected. For anyone after the age group of 18 years up to any age. So younger population usually it will be dry eyes associated with probably the use of computers, laptop, etc. Older population dry eyes can happen. That can be because of some systemic diseases like diabetes, thyroid, or other vitamin deficiency. Agarwals dry eyes cancer. So this kind of treatment is beneficial for all these patients. Dry eyes into you are not taking any treatment. However, it can cause other complications like kannu manjal kanisute and vision drop agadu, matte karigudde mele lot of scratches agadu and karigudde infection. Those are the severe complications that we can see.
Students ke concession is senior citizen of
right now, because of the launch, we do have an offer where dry eye evaluation free at Martivi along with the doctor consultation till next month mid. So during this time, it will be a good opportunity for everybody to utilize the same. Yes, there are multiple vitamins and vitamins, minerals, antioxidants and the so right quantities of fruits and vegetables, all options we have to consume very well. Suppose that it will definitely affect the eyes and also has impact in the form of dry eyes. So that's why we always say green leafy vegetables or different fruits to keep the eyes and overall health.